Hi, so today I'll be talking about antimicrobial resistance in bacteria. Before we get into everything, let's go over what antimicrobials are. And antimicrobials can be categorized by the microorganisms they fight against, and that includes antibiotics, antivirals, antifungals, antiseptics, and antiparasitics, which I will go over more in depth in the next few slides. According to the National Library of Medicine, antimicrobials are therapeutic substances used to prevent or treat infections. And now let's go over what antibiotics are. According to Medicine Plus, antibiotics are medicines that fight bacterial infections in people and animals. Some things antibiotics treat include skin and soft tissue infections, infections in the throat and respiratory system, infections in the urinary and reproductive system, and eye infections. Some antibiotic medication examples are gentamicin, which treats sepsis, and cephalexin, which is a broad-spectrum antibiotic that treats many bacterial infections like pneumonia or meningitis. Next, I'll go over antifungals. According to the Cleveland Clinic, antifungals are medicines that kill or stop the growth of fungi that cause infections. Antifungals treat fungal infections including athlete's foot, vaginal yeast infection, thrush, dandruff, and infections of the nails. A lot of antifungal medications are broad spectrum. Some examples of that are clotrimazole and iconazole, and they both treat many fungal infections like ringworm or athlete's foot. According to the Cleveland Clinic, antivirals are medications that help the body fight off harmful viruses. Antivirals treat viruses including COVID-19, the flu, some STDs, and common colds. Some antiviral medication examples are etofovir, which treats hepatitis B, and amantadine, which treats influenza. According to the National Institute of Health, antiparasitics are a group of medications used in the management and treatment of infections by parasites. Antiparasitic illnesses include Chagas disease, tapeworms, toxoplasmosis, and malaria. Some antiparasitics examples are piperazine, which treats roundworm and pinworm, and amodiquine, which treats malaria. Lastly, I'll be talking about antiseptics. And according to Healthline, antiseptics are substances that reduce or stop the growth of potentially harmful microorganisms on the skin and mucous membranes. And as you know, we used a lot of antiseptic practices in our labs this semester. Antiseptics are used to prevent skin infections, clean wounds, help treat skin conditions like acne or eczema. Some antiseptics include antibacterial dye that treats burns and wounds, and peroxide, which is used for mouthwash and disinfects the skin. So now that we've gone over what antimicrobials are, let's go over what antimicrobial resistance is. According to the World Health Organization, the definition of antimicrobial resistance is when pathogens change in response to the use of medicine. Antimicrobial resistance is a global health threat and is linked to 4.95 million deaths globally. Antimicrobial resistance makes infections more difficult to treat and causes people who undergo medical procedures at higher risk of complications during the healing process. And now that we've gotten some background info of microbials and antimicrobial resistance, let's get into why this occurs. Antimicrobial resistance happens when pathogens mutate to defeat the antimicrobials that were designed to get rid of them. One of the main drivers of antimicrobial resistance is the overuse of antimicrobials in organisms. This overuse is linked to the development of drug-resistant pathogens. Other factors include when a prescribed dosage is not fully finished, lingering pathogens can mutate to become resistant, and the excessive use of antimicrobials in agriculture. And here are some examples of disease strains that are resistant to antimicrobials and what that can lead to. First, we have methicillin-resistant Staphylococcus aureus. Typically, most staph bacteria strains are harmless, but in more serious cases, it can lead to sepsis and death. This antimicrobial resistant strain of staph is more difficult to treat, leading to those more serious cases being more likely. Due to its antimicrobial resistance, this strain of bacteria has caused around 100,000 deaths in 2019. Now, let's go over vancomycin-resistant Enterococcus, or VRE. Enterococcus can cause fever, chills, painful urination, and cloudy red-colored urine. In more serious cases, when left untreated, it can cause diseases in the urinary tract, heart valves, and brain. It is often transmitted to already compromised individuals that are in the hospital, so due to its antimicrobial resistance and spread to already sick individuals as a 24.5% mortality rate. And lastly, I'll discuss multi-drug resistant Mycobacterium tuberculosis. Tuberculosis is a lung infection that can cause shortness of breath, weight loss, and chronic coughing. Untreated, it can lead to death. Multi-drug resistant tuberculosis makes tuberculosis a lot more difficult to treat, leading to the tuberculosis bacteria staying in the body longer and causing more damage to the lungs. In 2021, 191,000 people died to contracting this strain of tuberculosis. So let's go over ways to reduce antimicrobial resistance. And the first one is to take medicine as prescribed. When prescribed a medication from the doctor, it is so important to take the correct dosage for the correct amount of time. Do not save medicine for when you become sick again, and do not share your medicine. Stopping the medicine too soon or too late or taking it not as prescribed can lead to antimicrobial resistance in the body. And this is something that a patient can't control, but it is important that healthcare providers to prescribe medication correctly and as needed. And the next one is to take preventative measures to not get sick. So obviously, the best way to prevent antimicrobial resistance is not getting sick in the first place. Practicing habits like wearing a mask around people who are sick is a great way to help prevent the spread of disease. And doing things like washing your hands and practicing good hygiene can help prevent illness. Also, eating healthy is super important as well because certain vitamins and minerals can help strengthen the immune system. So there are some things in place to help reduce antimicrobial resistance at a national and international level. There has been international support for the approval and the development of new antimicrobials that can combat resistant strains of diseases. The Food and Drug Administration is working with the Central Disease Control and Prevention to help spread awareness about antimicrobial resistance. There has been more of an effort to advise healthcare professionals to explain the proper dosage for prescribed medication and more of a support to be more mindful when prescribing antimicrobials. And here's my works cited, and thank you so much for watching.